You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Cathy Biase.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Cathy Biase, and I'm an holistic nutritionist and a professional cancer coach. Today, we're diving into a topic that might surprise you, overhydration. We constantly hear about the importance of drinking enough water, but what happens when you drink too much water? It turns out water can be too much of a good thing. From athletes pushing their limits to everyday people following the 8 glasses a day rule a little too strictly, overhydration can cause health issues. So, how do you find the right balance? And what are the warning signs that you're drinking too much? Our guest today is Dr. Tamara Hew-Butler, and she will lead our conversation as we explore the science, the risks, and the reality behind overhydration. Dr. Hew-Butler is a podiatric physician, an associate professor of exercise and sports science and physiology at Wayne State University in Detroit, Michigan. She obtained her Bachelor of Science in Kinesiology at the University of California at Los Angeles, her Doctor of Podiatric Medicine at Temple University in Philadelphia, and her Philosophy Doctor at the University of Cape Town, South Africa. Dr. Hew-Butler is a fellow of the American College of Sports Medicine and specializes in both sports medicine and exercise physiology. Her expertise is in exercise-associated hyponatremia, salt and water balance, and sports performance. She has published over 80 scientific articles, and her work has been highlighted on radio shows, television, podcasts, and newspapers. I love bringing a contrarian perspective to topics, and this certainly is one of them. In this show, we discuss why proper hydration is important for our health, what is hyponatremia, and how can overhydration lead to it, and what are some signs of overhydration. Stay tuned. This is going to be a great show. We will be back in just a few minutes to speak with Dr. Hew-Butler.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Cathy Biase.
Welcome back to the Health Hub. Please do follow us on our social sites. We are on Instagram, X, and Facebook, and we are at the Health Hub RMC on those locations. Tammy, welcome to the show.
Happy to be here.
Well, as we talked about a little bit offline, when something is such a strong trend like hydration, I love to find somebody who says, whoa, let's step back a sec. Let's take a look at things. And this is what you're doing when it comes to this area of conversation. But before we get into that, I think it's really nice to sort of lay the groundwork as to why this topic interests you. Now, you are an athlete yourself. Is this where your journey on the hydration avenue went or came from?
Yeah, so I'm a recreational, I can't say an athlete, but I'm a runner and I love running and it's just part of my lifestyle since I was in college. So, I started out, I'm a podiatrist by trade. So again, to being a runner, I'm like, hey, well, if I can't help anybody else, I can help myself. And so that was really where I started. I wasn't in science. I wasn't really interested in it at all, but they made me work in the medical tent. at the Houston Marathon where I was before. And at that time, just popping blisters, taping ankles. And it was hot during that particular marathon. And a bunch of runners collapsed and they ended up, they ended up in the hospital and there's four of them in comas. And they were intensive care and they almost died. And the diagnosis came back and it was hyponatremia. We're like, what's that? We had never really heard about it. There was a guy in South Africa who actually studied it. And so basically, hyponatremia means low blood salt. And so at the time when these runners got very sick and almost died, there was either two mechanisms. You either drank too much water or you lost too much salt and you didn't replace it. So fast forward maybe a year and two marathon runners actually died of this condition. So I actually left my job because runners are my family. I actually left my job and I moved to South Africa to study with the guy who first reported it. And I really wanted to know, are these runners drinking too much or they need to take in more salt? So we figured out that these runners, they were so fearful of dehydration. They're told to drink, it's going to be hot. You're going to die of heat stroke. So they drank a lot of water, and that actually became the mechanism. And you can actually die from drinking too much water, which I actually didn't realize either. So it shifted my focus into research. And so, my specialty is people who drink too much and get sick or die, which is overhydration. And still to this day, most people don't study overhydration. Most of the scientific work has been on dehydration and the perils of dehydration and how not getting enough water can make you sick. So I kind of come into this within a niche area, but it's my passion. It's a lot more complicated than people think. The more that you study a topic, the more involved and complex it gets. And I get faced with a lot of, social media is very active now. It's like, oh, you got to drink 8 glasses of water. It's healthy. It does all these things. And on my side, my bias is, hey, wait a minute. If you can actually have some adverse consequences if you actually, drink too much water. So, and it's very nuanced. It's not like when people ask, well, how much can I drink? It's not a very easy question, and there isn't one size fits all. So, I'm so happy to actually talk with you and just present some of the evidence, and so that people can think about it. And I'm going to cut to the chase. People say, well, what if you drink too much? Your body is amazing at actually handling too much or too little water because water is essential to life. And of course, if you drink too much water during the day, you're just going to pee it out. But just moving fast forward is why would you want to take in more and just pee it all out and waste it? So, that's, I think, moving forward when we talk about maybe the world getting warmer, maybe there'll be more droughts, that, I think we'll be talking about conservation a little bit more. The pendulum might swing back. So
wow, that's quite a broad application for this. I never even thought of something like that. I was, very tightly into the health aspect of it, but that is something to think about, really. Can the average Joe drink too much? Or are we talking about, just to, again, reel it in here a bit, can the average Joe drink too much, or are you talking within the specific area of athletes?
So, I focus on athletes, but again, to the average person, if you sit there and, you're 100 pounds like me, and someone says, drink this gallon of water. And if I did it, I would probably run into a lot of trouble. And we see that. And again, too, there was a very high profile case. It was a radio show and they had a contest, hold your Wii for a Wii. And at the time, a Wii was this very, very sophisticated video game. And so again, the contest was how much water that you can drink on the radio show until you had to pee. Because basically, if you drink too much, you just have to run to the bathroom. I mean, that's how your body works. And that's why we have kidneys. So anyway, what happened was one contestant, she didn't even win. She drank a lot of water, went home, and she was found dead. at home. So again, if you drink enough and you overwhelm the capacity for your kidneys to pee it all out, the water stays in your body, your brain swells and your lung swells. And what happens is your brain can only swell about 5 to 8%. Before it runs out of room in the skull. And once it actually hits the skull, it actually pushes the brainstem out and you can die fairly quickly. So it can happen to anybody, but again, too, it is very rare. It's very hard to drink yourself to death. It probably happens in less than 1% of the people, probably a little bit more in athletes because we are driven by the mantra of like, drink, 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 don't get dehydrated. And so, it can happen to anybody. There's also, just as a side because it's interesting, is like there's a condition in schizophrenic. And this is interesting too, because like people who have some mental conditions, they will actually say that the voices tell them to drink water, and they do. And when they drink enough water, the voices actually stop. But again, too, in people who are at rest and they drink a lot of water at once, they can get into trouble too. So it's not benign. I mean, again, too, it's very, very rare because we have a lot of physiological mechanisms that protect water balance. But yeah, I mean, it's a advice of where it can get people in serious health issues, and it can be very explosive. For me, it's like people go like, well, maybe this happens a lot. I go, no, once you see it and they have convulsions and seizures, you don't really miss that. So
are there lesser symptoms, lesser distresses that the body can be put under with overhydration? Illnesses that can come about, stomach conditions, anything like that, not to go to the extreme of dying, but are there conditions that you professionally might say, how much water are you drinking?
I'll take that in two different ways.
Okay.
And so one is like, are there medical conditions that probably require you to drink a little bit more water that might be helpful? Yes. If you are prone to kidney stones, the studies have shown drinking a little bit extra will reduce the incidence of that if you already have them. And then also too, if you're prone to bladder infections, drinking a little bit more water will, quote, flush out, some of the bacteria within the bladder. And so that could be helpful in reducing the incidence of bladder infections as well. So yes, there can be medical conditions that can be alleviated, and the data have shown that. The data haven't shown that it really increases your skin, make you have a glow. It doesn't reduce acne. It really doesn't reduce constipation that much.
Really?
Yes. I mean, because basically extra water is actually filtered through the kidney, not through your small intestines. Only when you really, really drink too much, where your body's just like trying to like get rid of the water, will you have some issues though. But the data are pretty, it's not that supportive. Some of the data on obesity is that drinking a lot of water maybe fills your stomach. If it replaces like a beverage with sugar in it, yes, it can help with that. But just drinking water on itself doesn't reduce obesity. And there's some interesting things that maybe it keeps you alert with cognition. But again, too, if you're driving and you're falling asleep, what do? You turn the radio on and you start drinking something because you're active. So again, that's a part of like the medical part. Like, yeah, some people need a little bit more water. The other issue that you alluded to, and this is a great question. It's like, well, what are some of the signs and symptoms that maybe you're drinking too much? Ironically, the signs and symptoms of maybe you're drinking a little bit too much water are the same as if you actually become dehydrated. You get muscle cramps, you get headaches, you get dizzy, you feel a little loopy. So for me, I had some of the best water intoxication researchers with me in the medical tent, and we couldn't tell. We couldn't tell if they were over or underhydrated when they came into the medical tent without a blood test. So with signs and symptoms alone, how do I notice? Well, if they say, I'm drinking a lot of water, they're a little bit bloated, their rings don't fit, and they have headache and they're a little dizzy, then I think, okay, maybe you got to like cut back a little bit. But again, too, the signs and symptoms are very vague, and they resemble a lot of other conditions, like actually not having enough water or like being in the heat for too long. So that's hard. It's very, very hard to tell. But my sister does that too. Oh, you need to drink a little bit of water. I've got a headache. I need to drink more
She's
water.
She's not reading your research, I assume?
Your family never listens to you, right?
I won't even comment on that, but I tend to agree. I tend to agree. Well, with mainstream TikTok, Instagram, all those, the social media, water is a great weight loss promoter. What are your thoughts on that?
Yeah, no, because if this, and I talk from the literature, if it fills if it makes you feel full, if it keeps you from eating calorie dense foods, if it keeps you from drinking beverages that contain calories, yes, it's good for weight loss. But the studies have, put them head to head in randomized controlled trials of, does drinking water in it of itself cause weight loss? No. But again, too, if it makes you feel full, and the data haven't support that, or if it actually keeps you from, taking in beverages with a lot of sugar, then yes. So it depends on the condition. It could in those conditions, but in other lights, just water in it of itself, drinking more of it doesn't seem to reduce the incidence of obesity.
Salt is making a comeback in some areas of health.
It is.
Yes. And because, as with fat, as with carbs, we all have our day in the sun, and we have the day in the sun of not having these things. And has the reduction, like the drastic reduction in salt in many people's diets, not been equalized by the balance of decreasing the hydration necessary?
Put in another way, my perspective electrolytes are hot now. The typical American diet is probably 3 times the recommended.
Okay.
So when people say
food wise, are you talking like more?
No, like a normal Western diet.
Okay.
So when people really get in, I'm going to actually take a little deviant here. When people really get into, if you think about a lot of things contain sodium. Sodium is also necessary for life, even some of the fruits and vegetables. If you're on a highly restricted diet, so the only problem that we see people who actually don't take in enough salt are very, very restrictive, like people who just drink beer. And again, too, if you don't take enough salt in your diet, that helps retain water. So does that decrease if a decrease in salt intake, does that decrease your requirement for water? Maybe it does, or you don't retain it. So on the flip side, if you take in way too much salt, you will get bloated, you will get thirsty, because that increases your body protects the amount of water to salt. So again, too, why do you have salted peanuts and pretzels at a bar? To make you drink more. So I guess on the very extreme side, if you're really, really decreasing your salt intake, you probably don't retain as much fluid. So is that bad for health? I think on the extreme ends, are most people on the extreme ends of really low salt intake? So if the typical Western diet is, I'm throwing numbers at you just to compare. If the typical Western diet is somewhere around 120 milliequivalents of salt, and the recommendations are 60 milliequivalents of salt. There are tribes in Brazil called the Yamamoto Indians. Their average daily salt intake is 1 milliequivalent. So, talk about a vegetarian that really doesn't take in any salt, but they do really well. And they also have a very low incidence of high blood pressure in that cohort as well. So I'm not exactly sure that, I'm reducing my salt. You probably don't get thirsty as much. You probably don't have as much of a water intake need, but is that disadvantageous? I wouldn't say the data supports that.
Is thirst the cue that we need to look to when we intake water? Because, there's a lot of talk that if you are thirsty, you're dehydrated. Is that incorrect?
Well, so it depends on, to me, if you're in biology, physiology, or medicine, thirst is the generalized signal that is in your body monitoring your water intake and status in real time. So if you drink when you're thirsty, you will probably avoid the bad consequence of being dehydrated, and you will probably avoid the bad consequence of being overhydration. Now, why people say that thirst is inadequate and that if you're thirsty, you're too late is because the definition of dehydration varies. So there isn't a wrong and a right. It depends on what the definition you use. So for a physiologist and people in medicine, we'll take your blood, and again too, we'll see a salt water ratio that's within a normal limit or not. So what your body's protecting is in the blood, the ratio of water to salt. Mm-hmm. If you're using a definition of dehydration, which we use a lot in sports by looking at your urine color. You hear that a lot.
Mm-hmm. Yep.
Urine color, if it's less than clear, then thirst, is delayed if you're looking at urine, because your urine's only clear if you're actually drinking in excess and you're peeing a lot of it out. Or if you're like stepping on a scale and you lost more than 2% of your body weight, you would have dehydrated. Those are easy metrics that people can do at home. But again, too, in those metrics, if you wait till you're thirsty, you would say that they would be dehydrated. If I took your blood, thirst is like perfect. But there's one, and this is, there's one more definition that we see a lot in the lay literature and in social media posts, is that people walk around, 50 to 75% of people are walking around dehydrated. And that actually comes from a survey. And the original survey was put out with by the International Bottled Water Association. Mm-hmm. And they surveyed over 3,000 people. And they said, do you drink 8 glasses of water? Didn't matter like anything else, tea, soda, juice. Do you drink 8 glasses of water per day? And if you said no, that you met the criteria for dehydration. And so that's how those numbers came about. So that's another definition that we see, like, why do 50 to 75% of us like walk around dehydrated? It came from a survey that was never published. And again, too, they did this with kids, with SodaStream. And they asked some mothers, does your kid drink 8 glasses of water per day? And so that's how we get the metric of 75% of children are walking around dehydrated. So the definition of dehydration varies. And so that's where the confusion is. So again, too, biologically, physiologically, and medically, thirst is a good indicator. It's your body, the sensors in your brain who are sampling your blood in real time are saying, we need a little bit more water here. And so that protects you against it's both extremes of underhydration and overhydration. But again, too, if you're using my urine color is like not clear, then you need to drink before you get thirsty because you have to be in water excess. And so that's where the confusion lies. Mm-hmm. So for me, thirst is like, it can apply to everybody in every situation. Whether you're in Minnesota sitting at a desk and it's -20, or you're in California and it's 80 and you're out running a marathon. Again, it's the rehydration app in your brain that is actually monitoring your fluid status in real time. Versus like, I need something to track it. Some people need something to track, and if you have a general baseline, I think that's good, but then also to, listen to your body. So that's where there's so much confusion there.
And then, bringing it back to where we started from in the segment, everybody is different. I mean,
yes.
160-pound woman may need far more hydration than someone your size who was 100 pounds. So the 8 glasses a day seems like such an arbitrary number to tag on to our sort of our health goals of the day. We'll come back to that when we start the second half. Everybody, we'll just take a couple of minutes here for a break.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Cathy Biase.
Welcome back to the Health Hub. Our guest today is Dr. Tamara Hew-Butler, and we are busting some myths about hydration. And one of the things, I think, Tammy, let's back it up just a touch. We've talked about the water-salt ratio or the impact of hydration on salt. Let's just start with just a biology 101 about the importance of salt and how water does affect it.
So your body doesn't really care just about the water or just about the salt. Your body actually cares about the balance between water and salt. So salt is mostly outside of the cells. Potassium is mostly inside of the cells. These ions really don't cross the membrane, but water can. And so water follows what you say, the osmotic flow. So if you drink too much water and you dilute the salt levels in your blood, the water's going to rush from into the cells so that all the cells swell. On the contrary, if you overdo your electrolyte package, could you think, oh, I need to do my salt? Then what happens is you increase the salt outside of the cells, and then all the water then will rush from inside of the cell to outside cells, and all the cells will actually shrink to try to accommodate this extra salt. So again, your body's looking at the ratio between water and salt, with water being able to move along the osmotic gradient. And that's really why we take a blood test. So I look at your blood sodium concentration. It should be anywhere between 135 and 145, which is, again, a very narrow range, just like blood sugar. So again, that's what your body's sampling all the time in your brain. That's why there's these sensors in your brain that are actually licking your blood and looking at ooh, is it too salty? I need more water, or is it too dilute? I need to actually stop taking in the water and you pee it all out. So again, it's the balance that's important, not just one or the other. Because we hear about your body's 60% water, so you need to replace 60%. No, it doesn't work like that. Some of the water in your body are stuck in places you'll never access. It's the balance between the two that your body actually preserves. And there's a gene that encodes for that balance, and that gene is 700 million years old. So it's really important for life.
You brought up the topic of electrolytes. They are hot in sports. They are, even people, on a daily take electrolytes, add that to their water. We're citing that our water isn't healthy enough, all sorts of different reasons to be taking electrolytes. What are your thoughts on that?
I think we have kidneys, and the kidneys actually do very well in terms of keeping our electrolytes as well as our water in balance. Who needs extra electrolytes? And I'll speak mostly with sodium because it's most abundant in the body. If you are exercising for more than 17 hours, you're not acclimatized to the heat. You probably need to take in a little bit more salt than in your normal diet. Other than that, I think, there's a lot of mechanisms that actually try to keep the balance. And so, one more window into my research looking at low salt levels because people drink too much. There are actually some we think of our bones as mostly calcium, but there's sodium in there too. And what some of the studies have shown or inferred in rat studies, as well as human studies, is that actually if the salt levels in your blood get too low, there's a storehouse within your bone, maybe even in your skin too, that actually you can draw sodium from. So, do you need to take it? And there's a certain amount. I mean, go ahead. Your kidneys are going to fix it. But again, too, there's probably some stored sodium within your body that you can tap into as well. Your body's just really amazing.
If you have low salt and the body can tap into the bones, does this impact the bones negatively?
Yes. So again, to looking at osteoporosis, particularly like for me in my cross country runners running 100 miles a week. I mean, you would think it's bone gets strengthened by the pounding, but they have like one of the lowest bone densities of all the athletes that I task.
Interesting.
Yes.
Wow.
So,
So then your
so they
advice to your athletes is what as they are running?
Yeah, just like don't hold back on the salt, man. Like if you want something salty or you crave it, or like feel free to salt your food. So again, too, I mean, these are my athletes, but again, too, in the clinical studies, people with osteoporosis actually have a lot more low salt levels over time too. So the data are very provocative. So people like if you're very very active, like the runners, again, don't hold back. You probably need it.
Back in the day when I was growing up, I never took a bottle of water anywhere.
Nope.
Have you done any studies? The bone health is very interesting. Have you done any studies on osteoporosis now versus then?
No, and again, too, those studies unfortunately have stopped because I can't take bone biopsies.
Okay.
Yeah, no, but that's a great point. Looking back at some of the osteoporosis, but again, too, like so now we have techniques like DEXA scans where we do young people. It used to be you just like got it if you're an old person. But that's a good point. I have to actually look back at that.
And our water sources, there's this one lady on, I follow, she's just there. I can't remember her name off the top of my head. And she talks about, the Gen X versus, she just, one of her posts was about, our our hydration came from the hose.
Yep.
And these days we're so hyper vigilant on the type of water that we drink. What's our body looking for? Like ultimately, what are we looking for when we drink water, when we hydrate ourselves?
Your body only cares about the H2O molecule, wherever it comes from. If you're eating vegetables or fruit or soup or like rice or anything other than plain water, it's looking for the molecules. All those things count. So that brings me to a really good point of like, where did the 8 glasses of water come from? It came from actually, a off the cuff comment from a nutritionist, but has been validated, like from 1945, going back to the old ways. Basically, the water, how much water do you lose during a day? So the typical 70-kilogram man the water turnover, you would lose 2 liters, which is eight glasses of water. But those, so these 2 liters or 8 glasses of water, they consist of the fluids found in food. So they say, okay, you need 2 liters or 8 glasses to replace that's normally lost. But that includes all of the moisture in foods as well as all the different beverages. It didn't include just plain water. And so somehow, some way, the 8 glasses of plain water came from those recommendations where it used to include, everything else that you eat that contains moisture. Your body just wants the molecules, whatever form that it's in. And I think we lose sight of that. And again, too, like particularly like these water bottles. And I was reading about how this new younger generation, it's like an emotional support bottle.
It's a trend. Yeah.
Yeah.
Absolutely.
So, do we need it? Probably not, but it makes you feel better. Go for it. I mean, but you get a lot of moisture, H2O from a variety of foods. So, people ask me about mineral water, oxygenated water, like flavored water, like vitamin water. I mean, it just like it all counts as H2O. Like, how do you drink more? You like the taste of it. So.
So you can flavor your water. Somebody who's eats more of a vegetarian meal would get more water from their sources than say someone who eats a lot more meat. So
Absolutely.
Those two. So just in those 2 examples, you can see how people can just be so different in their actual drinking water requirements.
Correct. And
So go ahead.
Go
Sorry.
on.
No, you go.
I was gonna say, on the, your health hub is like on like wellness. I think people shouldn't get like more anxious about like, oh, I'm not drinking enough water. I mean, I think that myth should be dispelled. Hey, you drink when you're thirsty, drink a little bit of extra, drink things that taste good. you're probably getting enough.
Mm-hmm.
So, sorry.
Are you getting pushback from
Absolutely.
people? And who are you getting pushback from?
So I'm a scientist, but I go up against a lot of marketing. I mean,
Mm-hmm.
there's a lot of money to be made in like tracking different types of like fluids. And and people like my students and like people get anxious. They think that they're not getting enough. And my students, I give you this story and people die and they're like, oh, okay, well, I still need my water bottle. And like I said, are you going to die if don't drink, if you no, you're not. Either way, you're probably going to be fine. But again, it goes back to, I've been fighting this for like 20 years. People go, "Oh, that's kind of cool, but I still need my water." And that's we're still going to be okay, but we shouldn't it shouldn't cause more anxiety that we need to like still like we're not healthy if we don't
Mm-hmm.
if we
Mm-hmm.
don't keep drinking. And I think that I also read of like the young people, like it's also a sign of health. Hey, I'm healthy. I got my
Mm-hmm.
water bottle, and I'm sipping it. It's
And
something
it's
that
easy. It's
it's
easy.
easy. You
Yeah.
can control, you can control that. You can control that. Like I'm healthy. But for me, like growing back in the dark ages with the garden hose, it's like, do you really need it? Probably not. Is it going to hurt you? Probably not.
Mm-hmm.
So
Exactly. Well, I one of the things that really drew me to your work was I am just even people in my own house here. My daughter walks
yeah,
around with her big water jug, and it's filled, two, three, four times a day, and she loves it. But me,
yeah,
I feel that I'm hardly ever thirsty.
right.
And so when I started reading your work, I was sort of relieved, because
Yay.
I honestly, I don't, of course, there are certain times I don't have a powerful thirst as a general rule. I don't know what that means. I do try and drink, 4 or 5 glasses of water a day. I'm high on vegetables and fruits, so I'm assuming that that's what's keeping me going. But to know that I don't have to chug 8 to 10 glasses of water a day, that just made me feel very good.
Yeah, and that's an important point. People a lot come up to me, they go, Tammy, my thirst is broken, because I never get thirsty. But if you're always sipping water throughout the day, you'll never trigger thirst because you don't need the extra water.
Mm-hmm.
Now, then I'll take you and I'll put you on a treadmill and I'll crank the temperature up to 90 degrees and I'll make you like walk for an hour. Then, yeah, you're going to feel like what it's going to be like
Mm-hmm.
to be thirsty. You're never there. So it's almost like, people say, well, I'm never hungry. But if you're always, eating and you're munching, you can override those signals, but you don't, they don't need to be stimulated because you actually have enough. Thirst is actually the same way. It's not like everybody has that sensation. Again, too, if I withhold water from you for a really long period of time, it's going to be so strong that that's all you're going to think about
Mm-hmm.
is like, where am I going to get some fluid? And once you get that fluid, it's like the best thing you've ever had in your entire life. So
Yeah,
it's,
absolutely. There are times when I am really thirsty.
yes.
And a glass of cold water is wonderful. And I'm going to really aggravate some people. Sometimes a cold glass of milk
Yeah.
is just something that quenches my thirst quite a
Yeah.
bit. And, when I'm working out, I sip water as I work out. I mean,
Yeah.
I always sip water as I'm working out. But as a rule, I'm not a thirsty person. And, it's just good to know that maybe that's just the way I'm built and not that I'm doing something that's wrong. Now we have tons of apps to track water intake and all sorts of things. Are you finding that there are now new things on the horizon to monitor excessive water intake?
Well, I mean, for me, like the end all be all would be like like have like glucose monitors that they're like small needles you put on and it continuously monitors your blood, the ratio between water and salt. I mean, that's the gold standard, and we don't have that. And I think that would solve all the problems. But the other, is there any way to track? I mean, so the utility of like having these devices that track your water, you can know what it is generally what your water intake is when it's hot, when it's cold, when you're active. And so, some people are very mathy and they like this baseline. But again, too, then you want to make sure that you defer. But for me, it's a blood test. I mean, if I suspect overhydration and it's making them loopy, I will, we have like, we need to take a little bit of your blood to look at it. So I think that would be the best monitor, but the companies are always like, well, there's no need for that. But I think there would be. People are so they're very obsessed with hydration and maintaining hydration status. And that again, too, is like what your body is protecting. And so.
What has been some, working with your patients, your clients, your athletes, has something stood out in your research or in protocol that has really surprised you?
For me, in the research that I'm pursuing now is looking at kidney disease. And we're seeing this in young people, like in their 30s. The field first saw it in like agricultural workers, like in South America, people working in the fields in the hot sun and drinking whatever they have. But we're finding that at 30, 40 years old they're having like kidney damage. And so now we're starting to see so I look at people who run 100 miles. So we're starting to see similar things in that population where these runners are really getting sick. And they seem to be drinking a lot of water as well, or other things. There's a lot of, we don't know what's in these sports nutrition products. But what my concern is there's a combination of heat, working on the heat, physical activity, and something that we're ingesting that seems to be making kidney damage more prominent in an earlier age. And so that surprised me. We used to see rhabdo and, we used to see people have like some kidney weird things like after the race, but it always like got better within a day or two. Now we're seeing this happening when they're not getting better in a day or two. They need to go into a hospital with dialysis. And I worry about with again too global warming, what we're taking in, how much or what is it that actually, are we causing damage? So that's been weird to me. That and the salt in the bone thing, that was pretty interesting.
But you're still within the athletic space. You're still a large supporter of distance running. Yeah.
I mean, those are my people. But again, those are my people. But I studied a lot of football, and they're this, they're big too. But I worry about with the heat, what do we do? Or also too, what's in these beverages or
Yeah.
So, I mean, I don't mean to be an alarmist though, but I think, we're seeing some funky stuff.
Interesting. Now, is your research continuing in this space? Are you veering off into anything different?
So for me, I've veered off into more like sports performance and, that's like, how do we make someone so that they don't overtrain, but they're at their peak? But again, too, like hydration wise, I'm very, what I'm very concerned is in this chronic kidney disease in younger people who are exercising in the heat and it's getting hotter. I think we need to actually start to understand that better because there's a lot of people who are at risk. We want to promote a healthy lifestyle. We want to promote people going outside and being active. But again, too, is there an adverse consequence to that? I used to not think that there was any, but now I think that we need to look at this a little bit more. So
this is I know we're getting towards the end of the show, but this is something that I've, is coming more and more to the forefront when I interview and when I'm researching and working with my own clients is overtraining and the not just the benefits, but the absolute need that it seems to be on having rest days.
Yes.
Would this help to balance the hydration plane that you are worried about?
So with overtraining, in when I started looking at overtraining, it was called overtraining. You just train too hard, and now it's the reverse. The data, it's like it's under recovery.
Mm-hmm.
So the thing is, like, you can't train. It's hard to train too hard. It's just like, but people don't take the recovery that they need. You need both. Does hydration play a part in that? I mean, I think we need to keep. I mean, hydration is important, obviously, in sport, but again, too, like, it goes back to milk. It's the things that we ingest and the timing of it that are important in terms of like helping our recovery as well.
Mm-hmm.
So I don't know if that was a weird workaround of your basic question. So I guess
Well,
what, like,
it was a great, it's a whole show in and of itself. It's just very interesting. I'm just wondering if you have, since beginning of the studying of your studies to now, if you too, within the realm of athleticism, have seen a real push for recovery days.
yes.
So that's very interesting. It's a whole other show, but regardless, thank you for that. I wanted to know if that has been something that has been popping up with your athletes as well. It's just one more person, one more scientist that's on this bandwagon of athletes, and you don't have to be an athlete, just somebody who goes to the gym a lot. You need your recovery days, and I think they need to be trumpeted. Totally different story. So we wanted to get back to the hydration plane. If someone wanted to follow your work, read about more what you're doing, where would they find you?
Probably my email would be best.
Okay.
I'm old school, and I only have a X Twitter account. I used to post a little bit more, but not so much now. It's an interesting climate.
Okay, well,
But
maybe
like,
if it works for you, we'll offer up your email address if people are interested in finding out more about your research.
I'd be happy, just like answer any questions that you would have. I would welcome that. So even too, like we're talking about the chronic kidney disease, I did another podcast and mentioned that because it was really interesting. It's alarming to me. And then, I have people actually reach out, and I love that. I love to hear about your story and just try to figure out, like, if you, particularly with hyponatremia as well, sometimes if you had a bad event, we learn, we can learn so much from you, and we want to help you, but also like help us warn other people of the consequences too.
Mm-hmm.
So I would appreciate that. I appreciate
Wonderful.
any input.
Well, we will definitely we'll put your X account up, and we will add your email address to the show. Can you give us your email address on the show now?
It's
and
Tamara.
then I will put in.
Yeah, it's Tamara.Hew-Butler at Wayne, WAYNE.edu.
Edu. Okay, and we'll also have that in the show notes. So, two ways to get that address. Thanks so much for being on the show. Wonderful show, really informative and interesting. So, thank you for being with us.
Thanks for having me. I enjoyed it.
Everybody, we will talk to you next week on the Health Hub.
You have been listening to The Health Hub, hosted by Cathy Biase, here on Radio Maria Canada.